welcome to the YouTube channel SAIEDUPHARMAA. Today we are going to discuss about lymphatic components and various diseases or disorders related to this lymphatic system components. This is very important because if we want to target any drug to the lymphatic system, then we should be very well aware of the various types of components related to lymphatic system. So what are the important components? As you can see here in this diagram, first is lymph, second comes lymph vessels, then central lymphoid tissues which constitutes of bone marrow and thymus, then peripheral lymphoid organs are lymph nodes, spleen, epithelial lymphoid tissues and circulating pool of lymphocytes. So now we will see one by one the functions of various components of lymphatic system. As you all know, lymph, it contains nutrients, oxygen, hormones, fatty acids, as well as toxins and cellular waste products. They are transported to and from cellular tissues. Then comes lymph vessels, in which you can see lymphatic capillaries, lymphatic vessels, and lymphatic trunks. Lymphatic capillaries, what they do is they allow diffusion of tissue fluids from intestinal space into lymphatic pathway. And the lymphatic vessels, they carry lymph from tissue spaces to the venous system. And it starts blindly as lymph capillaries in tissue spaces. Their walls are permeable to substances of much greater size. Then third one is lymphatic trunks. They transfer lymph to two lymphatic ducts which eventually expel all lymph fluid back to the blood. Further, when we will be seeing the components, then comes central lymphoid tissues. They are very important. First one is bone marrow, which produces all potent lymphoid cells, which helps in differentiation of B lymphocytes. And then comes thymus, which helps in differentiation of T lymphocytes. They are very important components of our immune system. Then next is peripheral lymphoid organs. These are very important because it happens that viruses, they go and stay or accumulate in these organs. These are lymph nodes, spleen and epithelial lymphoid tissues. Lymph nodes are small nodules of lymphoid tissue which are found in the course of smaller lymph vessels, and they purify the lymph from harmful agents. And spleen is very important organ as it removes old blood cells from circulating pool, and it keeps a reserve of blood for emergency, and it also synthesizes antibodies. Next is epithelial lymphoid tissues. Lymphoid nodules in places like alimentary canal and respiratory tracts, they work as a security check against all the incoming agents in the body. Next is lymphocytes. Mature B and T lymphocytes circulating in blood protects the body against any infectious agents that enters the blood. They are also very important part of our immune system. Now we will be seeing diseases of the lymphatic system. As you can see here diagrams, first is AIDS. In this HIV virus, it goes and stays in lymph node, spleen. Then lymphadenitis, in this lymph node infection occurs. In lymphadenopathy, lymph node enlargement occurs. And in lymphangitis, inflammation of lymph vessels occurs. Then next is lymphatic filariasis, which is also called as elephantitis. The lymphedema, lymphocytosis, we will see one by one in detail also. Then next is cancer of lymphatic vessels, that's lymphoma, Hodgkin's lymphoma. Then splenomegaly, tonsillitis. Now we will see in detail these diseases or disorders of the lymphatic system. First was lymphadenopathy. In this, the lymph nodes are swollen or enlarged, and the symptom is enlarged lymph nodes. And next is lymphadenitis, in which this is a inflammatory condition, and why it occurs in this infection, inflammation or cancer. These are the reasons for it. Then common symptoms include strep throat, mononucleosis, HIV infection and infected skin wounds. Next is this lymphedema. swelling or accumulation of fluid. This occurs because of blockage in lymphatic system, and it is caused by scar tissue from damaged lymph vessels or nodes. And it is often seen when lymph nodes are removed from those who had surgery or radiation to remove cancer. Next is lymphoma. Lymphoma is cancer of lymph nodes. It can be of two types, Hodgkin's and non-Hodgkin's lymphoma. It occurs when lymphocytes grow and multiply uncontrollably. Next is lymphangitis. This is inflammation of lymph vessels. Whenever there is itis word, then it shows inflammation. The next is lymphangioma. This is a condition that you are born with. It is malformation in the lymphatic system. Next is lymphangiomatosis. It is the presence of multiple or widespread lymphatic vascular malformations. Next is intestinal lymphangiectasia. This is a condition in which loss of lymph tissues occur in the small intestine, and it leads to loss of protein, then gamma globulins, albumin and lymphocytes. Next is lymphocytosis. This is a condition in which there is a higher than normal amount of lymphocytes in the body. Next is lymphatic filariasis. This is infection which is caused by parasite that causes the lymphatic system not to function correctly. So the main aim is that we try to reach the drugs so that they reach to the components of lymphatic system so that these disorders could be treated. Next is Castleman disease. It involves an overgrowth of cells in the body's lymphatic system. The myomatosis. This is a rare lung disease in which abnormal muscle-like cells begin to grow out of control in the lungs, lymph nodes and kidneys. Then autoimmune lymphoproliferative syndrome. This is very rare genetic disorder in which there is high number of lymphocytes in the lymph nodes, liver and spleen. Then mesenteric lymphadenitis. This is an inflammation of lymph nodes in the abdomen. Then next is tonsillitis. As I told, when there is itis, it means inflammation. So this is inflammation and infection of tonsils. So thanks. Here we have covered the components of lymphatic system as well as some of the disorders related to lymphatic system. So if you have any queries, you can write in the comment section, and do like, share and subscribe the channel Sai Edu Pharma.